Okay, good afternoon, good day, everyone. My name is Dr. Bukola Olutola. I'm a senior lecturer at the School of Engineering, Science and Health, Independent Institute of Education in South Africa. I'll be presenting this research titled Factors Influencing COVID-19 Vaccine Uptake Among Women in the Non-Urban Communities of South Africa. My co-authors are Kholisani and Siwelile Ndlangamandla. Thank you. This is the content. COVID-19 vaccine falls under Sustainable Development Goal 3, which says that we should ensure healthy lives and promote well-being for all at all ages, and specifically is target 3.B. And the indicator is that proportion of target population covered by all vaccines included in their national program. So when it comes to health and gender, there is usually gender inequality, and it can impact on how people experience crises and emergencies. And we all know that in most cases, it's the women and also probably children that face this type of problem. So they are susceptible to diseases, and sometimes they don't even have access to healthcare facilities like their male counterparts. And we know that they frequently encounter more significant obstacles in accessing health information and services, and that is according to the World Health Organization. And in life-threatening outbreaks like the COVID-19, things like this also occurred, with women. So looking at South Africa, South African rural women, it should be shown that improved health services and social grants have contributed to the advancements of rural women. In South Africa, you have grants, and you can also have free health services. But there are still some disparities that affect women in this part of the world, part of the country, including limited access to essential health services, where you see health professionals don't even go to the rural areas. They don't want to be posted there. And, you have a lot of women in rural areas. And some of these women do also have high quality education. And looking at the intersectionality of gender and other factors, rural living and other factors such as ethnicity, socioeconomic status, and geography, it is important, to look at this and how they contribute to, in terms of health and access to healthcare, including access to COVID-19 vaccine. Therefore, this study looked at the ways, this study identified the factors influencing COVID-19 vaccine uptake among rural South African women aged 15 and above. The study used the South African General Household Survey of 2022. This survey is conducted every year, so I'm sure they're busy with 2023 or is almost out, the 2023 one. And the data set have two parts. We have the person part data set and also the household. But for this particular study, we used the person data set. And the study used the interviewer-administered questionnaires to interview the study respondents, and different information were obtained, which included social demographic data and COVID vaccine uptake. So in the questionnaire, the question that was used to measure COVID-19 vaccine uptake was that the respondents were asked as so, remember is a person data, received a COVID-19 vaccine, and the options were dichotomized into no and yes. And the options included yes, partially vaccinated. That means probably the person still required a second Pfizer shot. Yes, fully vaccinated. That means if the person only had Johnson & Johnson or completed the 2 Pfizer shots, and yes, fully vaccinated with booster shots. So all the yeses were put together as yes, and those who said they never had any were put under no. And data analysis was conducted using chi-square and multivariable adjusted logistic regression. So these are the characteristics of the study population. Or the study participants. COVID-19 uptake. If you look at this, before we dichotomized, we try to use it as it was. Yeah, okay, we dichotomized, say yes, all the years with them together, but we were left with don't know and refuse. Those who said they never had any vaccine, COVID-19 vaccine, that means the rural women that never had COVID-19 vaccine were 48.6%. Those who said they had either one or partially or fully were 48.5%. Those who said they didn't know whether they had it or not, 2.8%. And those who said they refused, 0.9%. Now, the age category of the participants, the age was divided into 4 categories, 15 to 24. So most of our study participants fell between 15 and 24 years, so 28% of them. 45 and above were 26.5%. So these are the percentages of COVID-19 vaccine uptake in the study population in relation to socio-demographic characteristics. Looking at it, those who were the percentage of those who said they had COVID-19 vaccine, the 45 and above age category, they were the one that had the highest percentage of people with COVID-19 that took COVID-19 vaccine, 66.6%. The youngest ones, 15 to 24, they had the lowest percentage of people that took the vaccine. In terms of employment, the employed had the highest number of people, the highest percentage of people. In terms of education, those who had more than a grade 12 is the end of high school in South Africa. So those who had higher education, they are the highest percentage of people that said that they had COVID-19. That they had COVID-19 vaccine. In terms of marital status, the single, those who never married or who were not living together with any lover, they had the lowest percentage of people with that took COVID-19 vaccine. If you look at the race, for this, in terms of percentage, there was no statistically significant difference. Medical aid, those with medical aid had the highest percentage. And those who rated their health as poor, as fair actually, they had also the highest percentage of people saying that they took the vaccine. Cell phone, those who had cell phone had a higher percentage than those who did not have cell phone. Now, in relation to morbidities, we all remember that during COVID-19, there was this comorbidities. So all these people, asthma diagnosis, diabetes, HIV, they were diagnosed by a health professional, a doctor, a nurse. They were diagnosed to have all these diseases. If you look at asthma, there was no statistical significant difference. But those with diabetes, who were diagnosed with diabetes, they had the higher percentage that those who were not in terms of taking COVID-19 vaccine. Because of time, I'll move to the factors affecting that we looked at or that came out that were associated with COVID-19 vaccine uptake among non-urban women in South Africa. So these are the factors. If you look at the age, it shows that the older, the more likely that people took COVID-19 vaccine. Those older than 45 years and above, 45 years, they were more likely to take the vaccine. Education category, those with more than a grade 12, they are more likely compared to those with no education. There was no difference between no education, grade 1 to 11 and grade 12 in terms of COVID-19 uptake. Marital status, those single were less likely to take the vaccine. Now, racial group. Many studies in South Africa, have shown this, that the white, we are talking of women here, that white adults, they were less likely compared to the blacks in taking COVID-19. So no difference between blacks, colored, and Indian, or those of Asian origin in South Africa when it comes to COVID-19 vaccine uptake. Medical aid also is an important thing. Those who had medical aid were more likely to take the vaccine. Now, those who were diagnosed with high blood pressure or hypertension, those who were not diagnosed, that means the nose, they were less likely to take COVID-19 vaccine. Those who were not diagnosed with COVID-19, they were less likely to take the vaccine. Probably they felt that they were not sick, they didn't have to. But those who were diagnosed because it's a form of, especially with hypertension, because of morbidity, probably that's why they were ready to take the vaccine. Looking at self-rated health, those who rated their health as good, they were less likely compared to those who rated their health as excellent to take COVID-19 vaccine. And having a mobile phone, a cell phone, or not having a cell phone, which is makes one to be less likely to take COVID-19 vaccine. So having a mobile phone or a cell phone is very important when it comes to COVID-19 vaccine, because they have access to information. Those who have cell phone, they have more access to information, SMSs from government, than those who do not have any cell phone. They probably don't even know what is happening. So in conclusion, age, educational level, marital status, race, medical insurance, hypertension, and COVID-19 diagnosis, self-rated health, and owning a mobile phone are associated with COVID-19 vaccine uptake among non-urban women in South Africa during 2022. And like I said, it's been shown that white South Africans are more resistant to taking the COVID-19. White South African adults, they are less likely to take the vaccine compared to the black counterparts. And grade 12, having a grade 12 education, more than a grade 12 education, that is a diploma, degree, or anything more than a high school education, predisposes one and makes one to be able to take the vaccine, probably because of education, enlightenment, compared to those who do not have education. So that is the conclusion of the study. And the recommendation is that there is need for the South African government to look into these factors in order to address COVID-19 vaccine hesitancy and also resistance to other vaccines, not only COVID-19 now or in the future. Thank you.